Hello and good day to you wherever you are. I'm John Wright, and this is the history of the U.S. healthcare system, part 3. I'm going to go over the policies briefly that took down the U.S. healthcare system, starting with the 1960s. In 1960, we had 113 million people covered for hospital care, 107 million for surgical costs, 86 million for regular medical costs, and 38 million for major medical expenses. Right? Congress passes several initiatives to support training of physicians, dentists, professional nursing, and other health personnel. In 1965, Medicare was established, providing health care for the aged and disabled and those with end-stage diseases, financed under Social Security, paying 90 days of hospital care, 100 days of nursing home care, and 100 home health care visits. Private insurers refused to offer health insurance to older, disabled Americans. Medicaid is established as a medical safety net for the poorest, sickest, and most disabled, based on income or type of disability. Federal and state-funded program mandated that states provide children with early periodic screening, diagnostic, and treatment to prevent disabilities and to control transmissible illnesses. Right? In 1967, the campaign begins to make medical cost increase an issue. Right? The American Hospital Association announces that hospital expenses per patient day in 1967 were $57, a 30% increase of that in September of 1965. 1970, there are 7,156 hospitals with 1.62 million beds. It's going to go down from here. In 1971, President Nixon's special message on national health care outlines 3 basic proposals. 1, require employers to provide basic health insurance coverage. 2, replace Medicaid. 3, encourage the establishment of health maintenance organizations, or HMOs. Right? In 1972, Congress passes legislation that guts the original Hill Burton mandate that hospitals built with Hill Burton funds must provide care to the indigent patients. But what the legislation really stated in the fine print was that Hill Burton hospitals no longer have to set aside a certain number of beds for patients who cannot pay. In 1973, the Health Maintenance Organizations and Resources Development Act passes. Now, $375 million in federal aid to HMOs to cut medical costs and to give access to health services to medically underserved people. Congress requires that HMOs offer a set fee for basic health services, also 24-hour service to its enrollees, also charge a uniform fee regardless of an individual's enrollee's medical history, right? And to prohibit HMOs from expelling or denying coverage to anyone because of health conditions. In 1974, the Employee Retirement Income Security Act, or ERISA, is passed to provide uniform federal protections of employee group health, pension, and welfare plans. Under ERISA, such plans are preempted from state insurance oversight. Right? Should an ERISA protected health plan wrongfully deny or delay treatment, resulting in a patient's death, injury, or plan may be sued for actual cost of the treatment denied, not for the worsened medical crisis, death, or permanent disability that resulted from the lack of medical attention. Managed care companies are now protected in court from malpractice and liability suits after causing tens of thousands of catastrophic injuries, deaths, and lifelong disabilities. In 1975, the U.S. Healthcare Incorporation is formed. Also, funding for health service programs is renewed by Congress, overriding President Ford's veto. The number of hospitals drops by 33 since 1970, and the number of hospital beds declines by 150,000 across the country. In 1976, Congress alters the 1973 HMO legislation. After HMOs complain that congressional requirements saddle them with costs that make them more expensive and less able to compete with other medical services. See, the changes allow HMOs to deny enrollment to persons institutionalized with chronic disease or permanent injury. This is an example of where we see how the private sector cannot compete with government. In order to keep the private health institutions floating, that requires that those companies that make a profit that satisfies their investors. This is why the private sector needs to stay out of healthcare and why private healthcare for profit hospitals are unconstitutional. They go against the general welfare clause in the Constitution. Right? In 1978, 160 HMOs are now operating with 7.8 million enrollees. Federal aid to HMOs is now provided. The HMO outpatient facilities get extra funding as a part of an extra effort to reduce costly hospitalizations. Federal aid to HMOs equals fascism. The government gives the HMOs more money, and in return the HMOs will give the patients less services. In 1979, 11 cases of AIDS are identified. In 1980, hospitals invest heavily in nurse educators who train new registered nurse graduates for specialized areas, creating highly skilled staff within the hospitals. The number of hospitals declined by 191 since 1975, and the number of beds declined by another 100,000. The number of HMO plans rises to 236, with an enrollment now of 9 million people. In 1981, the last year that the federal government will assist the HMOs. In 1983, Medicare starts a prospective payment system in which hospitals are paid to preset rate based on a patient's diagnosis, not the actual cost, thereby penalizing hospitals for giving needed care that exceeds the DRG payment. Within 3 years, the length of hospital stays for elderly and disabled Medicare patients drops dramatically, as hospitals now send still sick patients home. In 1985, another 93 hospitals and 51,000 beds close since 1980. AIDS cases reaches 16,500, and AIDS is the leading cause of death among men between ages of 30 and 34 in New York City. There are now 393 HMOs with 19 million people covered. In 1986, tuberculosis reemerges from its steady decline. TB cases is now reversing, and a resurgence begins of TB. Patients receiving coronary artery bypass graft under managed care of HMOs shows a higher death rate than under traditional fee-service plans. Federal study of Medicare deaths finds a 10% increase in the 30-day stay at California hospitals. 25 million people are now enrolled in HMOs. And in the first lawsuit of its kind, a Michigan woman sues her Blue Cross Blue Shield HMO, stating that the profit-making mechanism enforced by her doctor led to denial of diagnostic tests and treatment for 2 years, during which she suffered from undiagnosed cervical cancer. Okay, so this is part 3 of the history of the U.S. healthcare system. As we continue down this road of fascism in our healthcare timeline, you are going to notice that HMOs are going to provide less and less services for more and more money. Is this the world you want to live in? Social Darwinism has replaced Christ-like thought and behavior in the United States at this very juncture, right? Smile, because it's about to get a lot worse. Thank you for listening. Have a great day wherever you are.